Some studies done over the past decade or so have now shown some statin drugs, particularly more potent statin drugs, may cause the development of diabetes in a small number of cases. To put it in perspective, there is about 9 to 10% chance on an average that somebody who does not have diabetes will develop diabetes after starting the use of statin. Most of the cases who develop diabetes are actually already pre-diabetic. In other words, they already are at the verge of developing diabetes, and statin therapy causes a little bit of increase in the risk of developing diabetes. It is important to remember that diabetes is a common problem, and that over the course of many years, people who have risk of prediabetes are going to get diabetes at the rate of about 10 to 11% per year anyway, but that increase will be probably relatively about another 10% over the 10 or 11%. In other words, there will be 1% additional risk of developing diabetes who were otherwise going to develop it anyway. The bottom line is that people who have prediabetes or who have early features of developing diabetes, they should be educated about the diet and exercise plan prior to going on statin therapy and while they are on statin therapy. However, it has also been shown that even those patients who develop diabetes on statin therapy still have lower risk of getting cardiovascular disease because they are now on the statin therapy. So if you think about the risk-benefit ratio, the benefit of statin therapy in people who have risk of developing diabetes later on is still much greater in preventing cardiovascular disease than in developing diabetes.